Hello friends, this is Dr. Rakesh Mittal, your surgery ka dost. Right. So today we'll be having a second session on colorectal cancers and the anal disorders. Right. We had one session earlier. We discussed a lot of questions based on colorectal cancer. So today, apart from colorectal cancer, we'll cover few non-cancerous conditions of the rectum and as well as the anal canal. Okay, so first is which of the following statements are true with regard to colorectal cancer? So as with the most of the questions in our field, when it is all of the above, so 7 out of 10 times the answer will be all of the above, but you must go through the choices. Almost 60% occur in the rectosigmoid area, right? So this is the distribution rough, right? So the most common is the left side, rectosigmoid. You can see sigmoid 21% and rectum 38%. So together it is almost 60%, right? So sigmoid, so we call it rectosigmoid. You know it, right? Reduced dietary fiber is associated with increased risk. This is true. This is from Love and Bailey. The intake of red meat that has N-nitroso compounds which are carcinogenic, that's a significant risk factor. Dietary fibers are protective. So they have protective effect. So less intake of dietary fibers will be increased risk factor, increased risk for the colorectal cancer because that reduces the colonic transit time, right? So that's how. So least malignant form is cauliflower type. Yes, this is true. Infiltrative variety is more malignant. Cauliflower type is less malignant. 20% present as an emergency with intestinal obstruction. This is true. See, this is the exact from the book. Exact line. Emergency presentation occurs in 20% and considerably associated with worse prognosis, right? And difference in the left and right side also, as most of you must be knowing, right side, particularly the cecal cancer, they more commonly presents with the bleeding, subtle bleeding, occult bleeding. Patient presents with black stools and anemia is the exact manifestation. Many of them come with a hemoglobin of 4 or 5, and then when you investigate, so you get a colonic cancer or cecal cancer. Left-sided more commonly presents with constipation or diarrhea or alternating diarrhea constipation, obstructive features. So obstruction and perforation is much more common on the descending colon, the left side. The rectal cancers commonly present with bleeding rectum.